Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hello, I'm Matthew Koffenberg, physical therapist and owner of Back in Motion Physical Therapy in Perham, Minnesota, as well as Park Rapids, Minnesota. You know, this week I had a couple of patients come in and they presented like this. So when I walk into the room, my patients usually are seated, so I'll be the patient. So they were seated and I came walking into the room. I knew they were coming in for some sort of back issue. So we talked for a while and then I asked them to go ahead and stand. So when they go and stand, it looks like this, and they're like really pushing themselves up. It's really difficult for them to stand. And when they get up, they look like this. Very much shifted over to the side. As soon as I see that, I know exactly what's going on. And it's actually quite easy to treat. It's very, very common. This may happen to you at some point as well. You know, you may get to that point where you're really, really shifted off to the side, really difficult to stand up because there's just so much intense pain in the low back. So what exactly is happening in that situation? So what's happening is it actually has to do with our discs. If you go back and look at some of my previous material, you'll see that we talk about the discs a lot. The discs of the low back create all sorts of problems in the spine. So in a case like that, where you're really, really shifted off to the side, what happens, so I've got a couple of pictures here, not my best drawings, but hopefully you'll get the gist of this. A couple of pictures here. One is a very healthy spine and the other is that shifted spine. So in the healthy spine, you've got vertebrae. So the lower back is called the lumbar spine, and there are actually 5 bones of the lumbar spine. So I've drawn out the bottom 3. In between each one of our vertebral bones, we have a disc. That disc is a softer material. It acts as a cushioning device for our spine. It's a softer material that's mainly made up of fluid, which is what that black component, that black circle is. It's just depicting the fluid within that disc. The fluid within the disc is very dynamic. What that means is it's constantly moving. It's constantly shifting off to one side or the other. So in a very healthy disc, or on a very healthy spine, the vertebrae stack on top of one another. In the case where the spine starts to be shifted, what's happening is that fluid has shifted off to one side and has not returned back to the middle. Again, it's very dynamic. A lot of times it'll shift to one side, but it'll come back to the middle. It'll shift and it'll come back to the middle. Sometimes it'll shift off to the side and actually get stuck there. So that's what this side is depicting. So between our 4th and 5th vertebral body, what has happened in this individual is the fluid has shifted all off to the side, which has caused the disc to bulge on one side. So the disc over here has gotten thicker and skinnier off to the side. So when that happens, you're thicker on one side, the spine will move with that. So the spine then starts to shift off to the side. And you end up with that position where someone looks like this. So again, when I see that, you know immediately what's going on, and it's very, very easy to treat. The treatment is getting that fluid to go back into the middle so that it looks like your healthy spine. So the first step to this particular treatment is to correct that shift. So if in this case, we would actually call this, as physical therapists, we would call this a left shift because it's our left side that's actually, even though the pelvis is shifting to the right, we name it by the shoulder. So we would call this a left pelvic shift. So what you would do in a case like that is you would ask your patient to go up to a wall with their left side against the wall. I usually have them put their left elbow against the wall. So remember, I'm shifted like this. So I'm going to put my left elbow against the wall. I'm going to take my right hand and place it up against my pelvis, and I'm going to use my hand to push my pelvis over. So that creates now more of a right shift. This is not comfortable. So if this happens to you, This is the treatment that I would recommend. Just know that it is not comfortable. It is very painful to do this. You're not hurting anything when you do this. It just hurts to do it. So again, you get here and you push yourself over. You hold it for 3-4 seconds and then you relax and you repeat. And I usually recommend that people do that every hour, and you do about 10 to 15 of these shifts every hour. It usually will take at least 1 full day, potentially up to 2 full days, to get you out of this position to this position. So that's the first step. So you want to get yourself straight again. Once you're in this position, again, it usually takes about 1 full day. Once you're here, your pain level will dramatically reduce. It'll go down to, the pain will probably drop about 75% of what it once was. Once you're here, you then want to spend about 2 weeks doing what we call sloppy push-ups. And the sloppy push-up is very easy to do, and the whole idea behind it is just to keep the disc positioned where it's supposed to. So a sloppy push-up looks like this. So you lie down on your stomach, propped up onto your elbows. I usually actually recommend that you stay on your elbows for about a minute. After about a minute being propped up onto your elbows, you then place your hands in the push-up position and you lift your upper body. We call it a sloppy push-up because you're not doing a full push-up, but you're doing the push-up motion. And then you repeat. And you just go back and forth about 15 times, and with that one you want to do about 3 times a day. So the first step is to get yourself straight, usually takes about a day, and then you want to spend about 2 weeks just doing that sloppy push-up. Within about 2 weeks you should feel about 100% better. If not, that's when you give me a call and we take a little bit of a closer look at what's going on. If you have any questions, please don't hesitate to call me at 218-346-2464. Thank you very much.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.